All right, we are going to talk about the cranial nerves in this video. So, the nerves of our body, these are bundles of axons located within the peripheral nervous system. So the cranial nerves may connect directly into the brain, but they are still part of the peripheral nervous system, not the central nervous system. So nerves, they're made up of these bundles of axons along with some connective tissue and even blood vessels to keep these in good condition. So the outer surface of the nerve is covered by a layer of fibrous connective tissue called the epineurium. So that's going to be that covering on the outside. Inside of the nerve, the axons are bundled together in fascicles. So this is very similar to how our skeletal muscles are arranged, where we have those fascicles as well. And each of these fascicles are surrounded by their own layer of connective tissue called the perineurium. And then individual axons themselves are surrounded by very loose connective tissue called the endoneurium. And so this kind of shows that breakdown. So if this is a full nerve, we're showing a spinal nerve here, but the cranial nerves will have the same structure. We have this epineurium on the surface. Deeper down within it, we have the perineuriums, which are bundles of axons. You can see some blood vessels coming through here around those different bundles of axons. And then if we zoom in a little bit more there, then around each of those individual axons is going to be that endoneurium. And so that's better represented a bit over here. So it would be around one of these little structures right there. All right. So lots of connective tissue within nerves. All right. And again, this arrangement should look relatively similar to what we saw with the muscles. There's just some slightly different names to each of these structures. All right, so nerves are named as either cranial or spinal nerves based on where they are connecting into the central nervous system. So cranial nerves connect into the brain and the cranium, spinal nerves connect to the spinal cord. Right? So here's a very, very close-up view. So this would be a bundle of axons. Here's that perineurium layer right here. And then this would be a single axon with that endoneurium layer around it. All right. So we're focused on cranial nerves here in this video. These are nerves, again, attached to the inferior side of the brain. There are 12 pairs of them based on their anatomical location from anterior to posterior. That's how they're numbered. And these are classified as either a sensory nerve, a motor nerve, or some combination of both, depending on exactly which nerve we're looking at. You're learning just a few of these in lab. That was previous material from last week. But there are more than what we're covering in lab. So here is that inferior view of the brain. So these are mostly responsible for sensory and motor functions of the head and neck, with a couple exceptions. There is one nerve that will target organs in the thoracic and abdominal cavities as part of the parasympathetic nervous system, which is part of the autonomic division. So we have CN1 through CN8. They also have other nerves, or other names, sorry. So cranial nerve 1 is the olfactory nerve. It's not actually shown here, but there are a bunch of little dots here where those olfactory nerves will come in to this olfactory bulb and then come back the olfactory tract for processing. All right. And so depending on where the axons originate determines whether they're sensory, motor, or some combination of both. All right, so if the nerves originate out of sensory ganglia that are external to the cranium, they're going to be sensory nerves. If they come out of motor nuclei within the brainstem, they'll be motor nerves. And then there's some that can do both of those functions. All right, so 3 of these nerves are exclusively sensory nerves, 5 are exclusively motor nerves, and the other 4 are mixed between sensory and motor. We'll see a table here in a couple more slides that will outline what each of these nerves do. But for lab, you are learning olfactory nerve and then olfactory bulb and olfactory tract right here. Optic nerve, this is cranial nerve number 2. That is these right here, along with the optic tracts, which are the lower portions of this X, and the optic chiasm here in between. All right. You'll also learn in lab the trigeminal nerve. This is cranial nerve 5, located right here on the side of the pons. And then the vestibulocochlear nerve, cranial nerve number 8, further down here, basically where the pons and medulla oblongata are connecting. So these outer little branches. And then the other nerve that is covered in lab is cranial nerve number 10, which is the vagus nerve, not spelled as in Las Vegas, spelled differently, but that is coming off the side of the medulla oblongata. But those are only, again, a few of all of the cranial nerves that we have in the body. All right, so there are some mnemonics to remember the nerve names. I'm not going to go over it because you're not learning all of the cranial nerves, so the mnemonic in this case might be a bit more confusing than is necessary, but if you're curious, the textbook does talk about it if you want to learn all of the cranial nerves. All right, just for funsies. EMTs, EMS people, and a lot of medical professionals learn how to assess whether or not these nerves are functioning correctly. If somebody comes in that's injured, they can assess whether or not there's potentially cranial nerve damage. So there are special tests that can be done to determine it. They're really simple, quick, easy tests. I had a student a couple years ago that actually ran through them with me just for fun because I was curious. And they're really, really easy tests to do. But if you have cranial nerve damage, then they would be a lot harder, right? So here's our list of cranial nerves. So cranial nerve 1, the olfactory nerve, this is smell. All right, so this is a sensory nerve exclusively. So S is for sensory, M is for motor, B is for both. Optic nerve, vision, another sensory nerve, that's for the eyes. Oculomotor, so this is going to be movement. So oculo means eyes also, but this is for eye movement. All right, so this is a motor nerve. The trochlear nerve is also going to do eye movements. So this is another motor nerve. All right, so the oculomotor nerve is responsible for eye movements, and it's controlling 4 of the muscles around the outside of the eye. It's also responsible for lifting up the upper eyelid when the eyes point up, and to help with constricting the pupils, so making that pupil smaller. And then the trochlear nerve is going to also, again, be responsible for eye movement, but it controls different muscles than the oculomotor nerve does. And then the abducens cranial nerve is also going to do eye movement as well, but again, these are each going to different muscles around the outside of the eye, but they're all motor nerves. So coming back up here to number 5, one of the ones you're learning for lab, the trigeminal nerve. This is both a sensory and motor nerve for the face. So its job is to help with cutaneous sensations, so sense of touch on the skin of the face. And then also controlling muscles of mastication, which is chewing. So the trigeminal nerve is going to help you be able to chew your food and stuff like that. Moving on down to the facial nerve, this is another motor and sensory nerve. So it's a motor nerve for the face. So it is going to help with mastication, so chewing again. And it's also going to be involved in facial expressions, so smiling or frowning and stuff like that. And then as a sensory nerve, it does help with the sense of taste, as well as the production of saliva. This is another one you'll need to know for lab again, vestibulocochlear. This is for hearing and balance. So we'll see this week as well with the ear models. So this is a sensory only nerve. Next one down, glossopharyngeal. This is a motor nerve for the throat. So that's swallowing reflex. So it controls some muscles in the oral cavity and upper portion of the esophagus or throat. So controlling some of those. And then it also is going to help with the sense of taste and producing saliva as well. Cranial nerve number 10, the other one that you need to know for lab, the vagus nerve. This is both motor and sensory within the autonomic nervous system. So those automatic responses of the viscera. We'll talk a bit more about this nerve in our last bit of lecture material next week when we do the somatic and autonomic divisions of the nervous system and take a closer look at those. This vagus nerve will come up again because of this. But it is really, really important for helping to maintain homeostasis within the organs of the thoracic and upper abdominal cavity. And it's really important part of our stress responses and counteracting the stress responses that we get. So we'll go into a bit more detail about that next week when we talk about the autonomic nervous system. All right, next up, cranial nerve 11, the accessory nerve. This is a motor nerve exclusively for the head and neck, along with some of the cervical spinal nerves are going to help with those head and neck movements. And then cranial nerve number 12, the hypoglossal, is another motor only, controlling the lower portion of the throat, as well as the tongue. And so this will help with swallowing a bit too. All right, so 4 of these make up the system, help with the autonomic nervous system for pupil constriction, salivation, and regulation of some of the organs. And so the oculomotor nerve, facial, glossopharyngeal, and vagus nerve are all also functioning within that autonomic nervous system, but we usually focus more on the vagus nerve within that than the other 3. All right, so lots of different movements here coming from the cranial nerves. Most other movements of the body are going to come from the spinal nerves coming directly out of the spinal cord. All right. That wraps up the cranial nerve chapter, and we will continue in the next video talking about the actual spinal cord and spinal nerves.